Hello, I am Dr. Ankur Garg, Director Liver Transplant and GI Surgery at Paras Group of Hospitals, Delhi, India. Liver transplant. Yes, it's a very complex surgery. It's a very complex treatment. But let me tell you, liver transplant is just not a life-saving surgery. It's a life-modifying surgery. If anybody of us has ever happened to see a patient suffering from liver failure, or what we call as cirrhosis, patients have jaundice, they have a lot of ascites, they have swelling in the legs, all their muscle mass and nutrition is lost. And many of the times they're barely able to walk, even to go to a washroom. So these are the kind of patients when they are diagnosed with chronic liver failure, with a lot of decompensation, a lot of problems, that is when a liver transplant is indicated. And a doubt comes that patient is already so sick, how will patient recover after liver transplant? Will patient be able to walk after liver transplant, or are we just doing a liver transplant to extend some years of life in this patient's life? So let me spread some knowledge on this, let me clear some myths. So liver transplant, yes, is a very complex procedure, but if you ask today, the success rate of liver transplants are exceeding 95% in properly selected patients. With me, I have experience of more than close to 3,000 liver transplants now, and I can say that more than 90% of my patients are doing well in life. By doing well in life does not mean that they're living a compromised life. So life after liver transplant, yes, it is not a magic, that today liver transplant happens and tomorrow patient will keep running. Patients on an average will require 15 to 20 days of hospitalization. Liver starts working right from day one after liver transplant, but it is not going to recover the nutrition, the muscle mass and the strength of the patient in one day. That is a gradual recovery which happens over a period of next 10 to 12 weeks. More than 70% of the patients, if timely done liver transplant, by the end of 3 months, they are fit enough to resume their work life back to normal, be it office work, be it field work, be it driving, be it traveling, anything. Patients who are more sick, more weak, they may take another 4 weeks or 6 weeks, maybe 4 months or 5 months of total recovery time. But I can assure you that more than 95% of the patients who undergo a successful liver transplant, within a span of 6 months, they will be leading an absolute normal quality of life like you and me. Looking at their faces, looking at them in public, we can't even tell them that they have undergone a surgery called liver transplant. So that is why I very commonly and very aptly say that liver transplant is just not a life-saving surgery, it is a life-modifying surgery. It indeed is a second chance to life. And so don't have those myths. If anybody of you or your loved ones or your friends ever requires liver transplant, don't be in those dilemma that why to do a liver transplant? Do we just want to extend some days or months for his life? No friends, it's not like that. Liver transplant is resuming life back to normal. Whether we are 10 years old, whether we are 40 years old, or whether we are 60 years old. Thank you.